What your hands are trying to tell you. 15 surprising signs of underlying health issues. My friend, take a look at your hands for a moment. Not just a quick glance, really look. The lines, the color of your nails, the texture of your skin. What if they were trying to tell you something? You see, your hands are more than just tools for gripping, typing, cooking, or waving. They're a silent messenger, a mirror of your internal health. For centuries, healers and physicians alike have looked to the hands for early clues about hidden illnesses. And today, science is catching up, showing us that subtle changes in your fingers, nails, or joints can often signal what's going wrong beneath the surface, sometimes long before symptoms appear elsewhere. In this article, we're going to uncover 15 surprising signs your hands may be sending you. Signals that could point to everything from nutrient deficiencies to liver trouble, autoimmune issues, or even heart disease. Because the truth is, your body whispers before it screams. And your hands? They may be whispering right now. Let's decode the signs, one by one, and learn how to listen more closely to what your body's been trying to say all along. 1. Arthritis, stiffness and swelling in the joints. If you wake up with stiff, swollen fingers, especially in both hands, you could be experiencing early signs of rheumatoid arthritis, RA. This autoimmune disease affects about 1.3 million Americans, causing joint pain and inflammation. Osteoarthritis, OA, a degenerative condition, also affects the hands but usually starts in one hand before progressing. Early treatment can help prevent joint deformities and loss of function. 2. Carpal tunnel syndrome, numbness and tingling in fingers. Frequent tingling, numbness, or a burning sensation in the thumb, index, and middle fingers may indicate carpal tunnel syndrome. This occurs when a median nerve is compressed due to repetitive hand movements. Studies show that about 3 to 6% of adults suffer from this condition, and if left untreated, it can cause permanent nerve damage. 3. Raynaud's disease, fingers turning white, blue, or red. If your fingers change color in response to cold or stress, turning white, then blue, then red, it could be a sign of Raynaud's disease. This condition affects around 5% of the U.S. population, restricting blood flow to the fingers and toes. Managing stress and keeping your hands warm can help prevent episodes. 4. Diabetes, tingling and nerve damage in fingers. High blood sugar levels can lead to diabetic neuropathy, affecting the nerves in the hands and feet. Symptoms include tingling, burning pain, and loss of sensation. Studies estimate that 50% of people with diabetes will develop some form of neuropathy. Controlling blood sugar levels through diet and medication can slow progression. 5. Liver disease, red palms, pulmonary erythema. If your palms are consistently red or flushed, this could be a sign of liver disease, particularly cirrhosis. About 23% of people with liver cirrhosis develop pulmonary erythema due to changes in hormone levels and blood circulation. If accompanied by fatigue, jaundice, or swelling, the liver function test is recommended. 6. Thyroid problems, dry skin and brittle nails. An underactive thyroid, hypothyroidism, can cause dry, flaky skin on the hands, brittle nails, and slow wound healing. Hyperthyroidism, on the other hand, can lead to sweaty palms and soft, thin nails. Around 12% of Americans will develop thyroid disease in their lifetime. A simple blood test can check your thyroid hormone levels. 7. Anemia, pale or bluish nails. If your nail beds look pale, bluish, or lack color, it could indicate anemia, a condition caused by low red blood cell levels. Iron deficiency anemia is the most common type, affecting around 1.6 billion people worldwide. Symptoms include fatigue, dizziness, and shortness of breath. 8. Finger clubbing, rounded fingertips, and curved nails. If your fingertips appear larger or rounder with nails curving over them, this could be a sign of lung disease, heart disease, or even cancer. Clubbing occurs due to low oxygen levels in the blood. It is a serious symptom that requires immediate medical attention. 9. Psoriasis, pitted and discolored nails. Psoriasis, an autoimmune skin condition, affects about 7.5 million Americans. When it impacts the nails, you may notice pitting, ridges, yellowish discoloration, or nail separation. In some cases, it is linked to psoriatic arthritis, which affects the joints in the hands. 10. Dehydration, dry, cracked hands, and weak nails. If your hands feel rough, cracked, or excessively dry, you may not be drinking enough water. Chronic dehydration can also lead to brittle, peeling nails. Experts recommend drinking at least 8 cups of water per day to maintain proper hydration. 11. Vitamin deficiencies, white spots, and ridges on nails. White spots, ridges, or peeling nails can indicate deficiencies in zinc, iron, calcium, or B vitamins. For example, B12 deficiency can cause bluish nails, while iron deficiency leads to spoon-shaped nails. A balanced diet rich in whole foods can help restore nail health. 12. Gout, sudden, intense pain in fingers. Gout, a form of arthritis caused by high uric acid levels, often affects the big toe, but can also appear in the hands. It causes severe pain, redness, and swelling, usually occurring at night. Around 8.3 million Americans have gout. Avoiding purine-rich foods like red meat and alcohol can help prevent flare-ups. 13. Poor circulation, cold, numb, or tingly fingers. If your fingers frequently feel cold, numb, or tingly, it could be a sign of poor circulation due to conditions like peripheral artery disease, PAD. PAD affects around 8.5 million Americans and increases the risk of heart disease and stroke. Exercise and a heart-healthy diet can improve circulation. 14. Dupuytren's contracture, curled fingers due to tissue thickening. This condition causes thickened tissue in the palm, leading to fingers curling inward over time. It is more common in men over 50 and those of Northern European descent. While the exact cause is unknown, early treatment can help maintain hand function. 15. Trigger finger, locked or clicking finger joints. If your finger gets stuck in a bent position and then suddenly straightens with a snap, you may have trigger finger. This condition is caused by inflammation of the tendons in the finger and is more common in people with diabetes or rheumatoid arthritis. Rest, stretching, and anti-inflammatory treatments can help relieve symptoms. Conclusion: listen to what your hands are telling you. From arthritis to thyroid issues, your hands can reveal critical insights into your health. If you notice persistent changes, don't ignore them. Your body could be signaling an underlying condition. Early detection can make a huge difference in treatment and prevention. If you found this information helpful, share it with your loved ones. Keep an eye on your hands. They might just save your life.